All right, if you're just joining us, the program is Let's Talk Health, and this is the interview segment. And today on the program, we are talking about the fear of overcoming spine surgery in Nigeria. And with me to talk about this is Dr. Biodun Ogungbo. He is a brain and spine specialist. Thank you for joining us on the program.
Thank you for having me. Thanks a lot.
All right, now first of all, let's start with knowing what medical conditions can lead one to getting a spine surgery.
Well, I suppose the commonest reason for anybody to have a spine operation might be what we call degenerative diseases, which simply means arthritis. Arthritis is wear and tear. You appreciate that if you go into a car showroom, you buy a brand new car, as soon as you start driving it, it starts falling apart bit by bit. Same thing happens to us, as human beings. God has made it such that we grow and grow until we're about 20 years of age. Then we stop growing. From that point onwards, we start deteriorating. So for many people, you start losing their hearing, start losing vision, start losing memory. Part of all that growing old is this, what we call degenerative diseases, which is wear and tear of different parts of the body. So the joints start causing pain. You start having pressure on nerves, start causing weakness, numbness, and if it's happening in the spine, then it becomes sometimes a reason for considering an operation.
Okay, what's the process of the operation? I just want to have an idea.
Well, I suppose the key thing is, if you think about it in the sense that if somebody is in a lot of pain, any pain that is making a grown man cry, for example, is not tolerable. And especially we're talking about the spine, for example, if it is causing weakness of the legs, numbness in the legs, if there are now problems with passing urine, passing stool, then you may think, well, these things are so bad.
Is back pain inclusive?
Absolutely. Then they may need an operation. But operation is often the last resort. It's not what we jump into unless there's a specific reason. So, for example, we will push and advise an operation if somebody has a spine tumor, cancer in the spine. If somebody has infection, like tuberculosis sometimes can be destroying the bone, then we may be forced to say, you must have an operation. If somebody has had a road traffic accident and they've broken their spine, they've now got paralysis, sometimes we may push that they should have an operation. But outside of that, people still have a choice as to whether you want an operation or not.
So if I don't want an operation, what's the other?
Well, if you don't want an operation, then there's lots of other things that can be done. And one is knowing what the problem is. Is it pain? There are painkillers to use. If it is difficulty in moving, you may need a physiotherapist or a chiropractor. You may need to lose weight. Some people may need to stop smoking. So so many different things that you can do. If we as doctors or spine specialists say an operation is not indicated or an operation should wait and be deferred till there are stronger reasons to operate, then we'll wait.
Now let's have a look at the misconceptions, the myths that surround going in for spine surgery. Whether I would like it or not, there are people who are scared. They've heard of different stories. Probably people go in and they don't make it out alive, and it just gets to their head. And there are different stories surrounding spine surgery. So can we look at some of those myths and misconceptions?
I suppose the most common thing is that people think that when you're going for an operation on the spine, you either become paralyzed or dead, and maybe that was happening in the past. It's certainly not happening anymore. In fact, recently I've had even doctors thinking spine operations are 50-50, which is like game of chance. If your best bets are 50-50, why would anyone want to have an operation? But in truth, it is a lot better than that. We have improved so much that the good outcome for spine surgery is almost about 90-95%. So things are a lot better than before.
Would you attribute all of these misconceptions to the poor health delivery of the country? And when you say things have improved, have things improved in the public health sector, or it's in the private space?
I think in truth a lot of things are improving in Nigeria in the healthcare sector. Even the public hospitals are getting better. Private hospitals, of course, are the leaders when it comes to delivery of good quality healthcare, because this is there's a financial incentive for private hospitals to do better. But in general, things are getting better. If we talk specifically about spine, there are now many more spine surgeons in Nigeria.
Okay.
There are now many more spine surgeons who are skilled and who have the requisite equipment to carry out the operations. We're also collaborating among ourselves, to deliver better care, to communicate, to share information, so that we make better decisions and then, do better operations. So for us, especially in the private sector, things are definitely on the up.
Okay.
Lots of other people in the public sector are also catching up.
Okay. Now let's look at one of the things that people ask: what is there? Is age a factor when it comes to spine surgery? And then I didn't ask initially, at what age do people really come down with spine problems? Is there a specific age?
No, spine problems can occur at any age.
Okay.
I mean, there are babies born with spine deformities.
Okay.
There are young children who have infection. There are those who have a bendy spine called scoliosis, where their spine is bent
over,
because they're growing up, they're becoming teenagers.
And in the case of scoliosis, is there a remedy for that?
Yes, there is a definite remedy, which could be just physiotherapy and wearing a brace, or if need be, then they can have an operation, because it can actually do a lot of harm. So they can have an operation.
Okay.
But moving forward, teenagers, young adults, they have road traffic accidents, they have falls, so they can damage their spine. Older than that, 40, 50-year-old, they start coming down with arthritis, these degenerative diseases. They get infections, from diabetes. People get tuberculosis. Older people, of course, there's cancer. So there's so many different age groups, and different people can have problems with their spine. That's about the answer to that particular question.
Okay.
Yeah.
Okay, now let's look at the how affordable is spine surgery in Nigeria, because you've mentioned that the private care sector being the key people involved in it.
I think spine operations are cheaper in Nigeria than going abroad. That's on this, if you put them on scale, a lot cheaper. An operation that will cost $1 million or 2 million naira here will cost about 3 times that when you go abroad. Then you also have to factor in the cost of travel, and sometimes another person may have to travel with the patient, to go outside the country. So it's a lot more expensive to travel out. But here, it's still cheaper in the public hospitals than in the private sector. But of course, in the private sector, you get your operation quicker. You can get it, almost on the same day if need be, compared to a public hospital. So there are those kind of differences. But by and large, it's a lot cheaper in Nigeria than going abroad.
Okay, now what can be done to dispel the fears that people have as regards spine surgery? What awareness is being put out there? How have people been able to know that, okay, this can be done without anything happening to you? What can really be done about that?
I think the key thing is for us as spine surgeons, for doctors in general, to be aware, that things are
you have
improving.
Doctors, saying, like you mentioned earlier, saying it's a 50-50
absolutely
scenario.
There are a lot of doctors.
When the doctors even have this mentality, what's now happens to the patients?
I think it's fear from the past, and a lot of bad stories that are out there. But of course, when you actually pin people down, when they say something like, I hear, somebody's been paralyzed. Who exactly has been paralyzed? Have you seen the person? And, so most people may not actually realize that somebody that they think has been paralyzed by, following surgery, maybe was paralyzed even before the operation, and the operation was actually being performed to reverse, that situation. But of course, people then think, they've done the operation, they're still paralyzed, it was the operation, but it may not have been. Sadly, of course, once the bad rumors or this kind of information, goes out, it travels so very wide and fast. So what we need to do is to reverse that kind of narrative and say, as at today in Nigeria, spine operations are being performed. They're being performed safely. They're being performed with better outcomes than before. And the range of operations that we can do has actually increased quite significantly. So we can deliver better outcomes, for people. Okay,
now let me ask you this. You are a stakeholder in the private sector. What can be done to help people who cannot afford the 1 million, 2 million-ish amount of spine surgery in Nigeria? Do you do anything to, reduce the fee for that?
No, what we can do in the private sector is operate free of charge on patients who are in extremis. You know, for example, we've operated on patients who young men, especially who have had road traffic accidents, who have broken their spines, they've been paralyzed, but they can't afford surgery. But if they come, we will operate, because we can't turn that kind of person away. You know, so when there's a real need, you know, definitely, and you know, this is urgent, we will operate, we will help out. In total, what we're hoping is that so long as people believe in us, so long as Nigerians trust us and stay home to have the operations done, if we have a larger number of people to operate on, then we can work with smaller margins, and be able to deliver care to a lot more people, which means the costs will come down. So we need to change the way people think and view spine surgery in Nigeria, that listen, come, trust us, we'll do the best we can, we'll get you better outcomes, and at the moment about 90 to 95% good outcome. We can't say 100%, of course, because you know, we're not God. You know, only the Almighty can deliver that level of care, but 90-95% for the majority of people, those are very good odds, much better than 50-50. So if they come to us and if we're able to do more, we'll get better, we'll get, you know, more experience, we'll be able to do much more. The cost will then go down. If the costs go down, a lot more people will benefit. So everybody wins.
There's also a way of ending medical tourism in Nigeria.
Absolutely, we can reverse. We can reverse it, definitely.
Okay, Rob. Before I let you go, what's your last word to viewers this morning?
I think the key thing is for people to know that we are doing way better with spine care in Nigeria now. Whether it be conservative, that means no operations, or with surgery, and specifically on surgery, we're not killing or paralyzing people. You know, we are delivering better outcomes for Nigerians.
All right, thank you very much for coming on the show today. We hope you've been enlightened so far. Thank you so much. The program is Let's Talk Health, and it continues right after now. To stay with us.